Morning, everyone. We just getting started here. We'll let people join and get going in a few seconds. Morning. We'll give it a few more seconds before we get going, just to let a few more people join. All right. Well, I think I will turn it over to Michelle Leek, President and CEO of Colorado Health Institute, to get us started.
Good morning, and welcome to the November edition of Eggheads from the Colorado Health Institute. It's our webinar series. I want to thank you for joining us today. I know this time of year is especially busy, and we appreciate the early morning participation from all of you. I'm Michelle Leek, and I'm the president of the Colorado Health Institute. And before we start, just a couple of housekeeping items. Please know that this session is being recorded so that we can post it on our website and allow people who are not here today to also be able to access our presentation. And that we'll have two short presentations today, but there'll be plenty of time for questions. I looked at the list this morning of people who are joining us. I think most of you know the Colorado Health Institute, but for those of you who don't, we're an organization that is founded on a belief that good health policy leads to a better health outcomes and a healthier Colorado. And every day we provide research and insight and expertise to do just that, to inform leaders across the state, because informed decisions lead to better health for all. We are an independent nonprofit organization, and we do work like this that's public facing and accessible to everyone, and that's funded by philanthropic concerns across the state. We also do consulting work for community groups and hospitals and government agencies and other foundations. And so those are sort of the two hats that we wear here. Eggheads we started during the pandemic as a way of staying connected with all of you in our health policy community. And it's really become a bright spot for us to just reach out and engage with all of you. So thank you again for your participation. Eggheads is also symbolic of the nerdy fun we try and have here at CHI. And I recognize that the title of this presentation today, Job Loss, COVID, and Health, may not be the most uplifting, but I'm enthusiastic about the presentations, and I hope they bring you a sense of optimism as we move forward and through this pandemic. So with that, I'm going to hand things over to my colleague and presenter, Joe Hannell. Joe, thank you and good morning.
Morning, Michelle. Morning, friends. Thanks for joining us today. I'm Joe Hannell. I am the communications director at the Colorado Health Institute. I've worked here for 7.5 years now. That kind of blows my mind. But I've worked on 4 Colorado Health Access surveys now, going back to 2015. And I've been pretty deeply involved in the 2021 version, but not so much as my colleague, who I'll introduce right now, Lindsay Whittington.
Hi, everybody. So I'm Lindsay Whittington. So I've worked at CHI for, I think it was just my 2-year anniversary last week. So that's really exciting. So at CHI, I'm one of the statistical analysts. And a large part of my job actually revolves around the data management and analysis of the Colorado Health Access Survey, which we're going to be presenting lots of findings on today. So I'm glad you all could join us.
All right, thanks, Lindsay. I'll get right into our presentation here. Sorry for the technical glitch there. All right. So I'm going to be talking about job loss, COVID, and health. Most of the data you'll see comes from the Colorado Health Access Survey 2021, which we released last month. First, though, none of this would be possible without our sponsors, chiefly the Colorado Health Foundation, which stepped in to be the lead funder of the 2021 survey. Also, we had support from the Community First Foundation, Colorado Springs Health Foundation, Delta Dental Colorado Foundation, Rocky Mountain Health Foundation, and then other sponsors chose to underwrite specific questions, including Latino Community Foundation of Colorado, the State Office of Behavioral Health, and Department of Healthcare Policy and Financing, and the UCLA Center for Health Policy Research. So these are the groups that made the 2021 survey possible. We are looking for others too to keep this community resource going in 2023. So I'll have an email address for you at the end of the presentation of our principal investigator of the survey, Jeff Bontrager. Contact him if you can support the survey in any way, including by informing questions that we should be asking as we move into 2022 and 2023. So the takeaways from my part of the presentation are that we found job loss during the pandemic to be highly associated with declines in physical and mental health. Now, the second one is crucial. The effects continued on throughout the year of the pandemic until the survey was administered. And third, physical, mental, economic health, they are really all of a piece. There's just no use trying to separate them when we're addressing that for people who've been through a lot in the past couple of years. So most of the data you'll see comes from the CHAS, the Colorado Health Access Survey. It's a really large survey. The large sample size allows us to parse out and run crosstabs on a lot of different measures and still allow for a statistically significant sample. Traditional topics on the survey have been what's called the Colorado Health Access Survey. So it started out as about access and insurance and the way people use healthcare, but we have expanded it in recent years to include social factors and in the housing, hunger. And in 2021, we added questions about COVID-19 and veteran status. And those are the two topics you'll hear about today. So if you joined us for our survey launch last month, you might remember this graphic. This shows a lot of the questions that we'd asked about people's experience during COVID-19. And today we're going to zero in on this one group of people, about 500,000 Coloradans who had lost their jobs during the pandemic. About 12% of adults said that they'd lost their job. So 18 months ago, large sectors of the US economy shut down in the course of just a few weeks. So you can see exactly where that happened on this chart. This is the unemployment rate in Colorado. And there are a lot of notable aspects to this graphic, I think. First of all, if you look at the left side, in February 2020, we had historically low unemployment. It was below 3%. And then there was a historic spike in unemployment up to more than 12%, followed by a pretty sharp drop, or a very sharp drop 3 months after that. And then kind of a steady continued decline, but we're still above the unemployment rate that we were before the pandemic. In fact, in Colorado, it's double the rate it was before the pandemic. So quick note here, on the definition of unemployment, people are counted as unemployed when they don't have a job, but they're looking for one. So that's what this graph shows. It's not from the CHAS, it's from the US Bureau of Labor Statistics. as is this next graph. We do see people going back to work, but not at the same level as before. And this graph shows you why, shows you the effect of that. Before the pandemic, about 2/3 of the state population was in the labor force. The ones who weren't were like kids, retirees, people who do unpaid work, like raising kids. But then the ratio of employed people to the overall population dropped about 10 percentage points when COVID hit. A very dramatic graph here. And then there's a sharp spike or a sharp rebound, but not as sharp as the drop. And it started to plateau out. And we're still down a few percentage points from where we were, and it looks like it is stabilized. This is probably why you're seeing help wanted signs everywhere you go. This is the Great Resignation, where or some of the effects of this are the Great Resignation. It is harder and harder to find workers these days, and it's reflected here. Our labor force isn't as big as it used to be compared to the overall population. Unfortunately, the Colorado Health Access Survey can't tell us about the dynamics behind this, what we're seeing here in this phenomenon in the Great Resignation. But it can tell us what became of workers when they lost their jobs, as far as their health goes. And the first thing is that nearly 4 in 10 people who lost their jobs because of COVID were still looking for work as of the day they answered the survey, which was sometime between February and June of this year. And about 5% had left the workforce entirely. That compares to only about 5% of people who hadn't lost their job because of COVID being unemployed at the time the survey was taken. And the big gray slice at the bottom, on the bottom bar, 30%, that again is the folks who are not in the workforce. These are retirees, people who do unpaid work, not in the formal economy. We also know from the CHAS that our collective mental health has suffered a serious setback. We asked 2 questions about mental health on the survey. The top, this first graph here shows the traditional mental health question that we asked. We asked people how many days of poor mental health they'd experienced in the previous month. And if they say 8 or more days of poor mental health, then for the purposes of reporting on the survey, we consider that to be poor mental health. That number rose to almost a quarter of Coloradans reporting 8 or more days of poor mental health. And then we also asked people new this year if their mental health declined as a result of COVID. Separate question here. And we gave them prompts like, do they have an increase in anxiety or loneliness, feelings of isolation? So this bottom graphic shows that even more people answered yes to that question. And the effects were especially concentrated among young adults. More than half of adults in their 20s said that their mental health suffered as a result of the pandemic. And it turns out that losing a job is probably one of the biggest contributors to COVID-related stress. When we looked at the data, the people who lost their job, this was a group that really stood out. In fact, they were twice as likely to say their mental health declined during the pandemic than people who hadn't lost their jobs. Now we have to break for an aside about correlation and causation. Which is the chicken, which is the egg? Statistically, I can't tell you what's the cause of the correlation between job loss and a drop in mental health, but I can use other tools at our disposal to figure out what's going on, such as a lot of studies on the impact of job loss and health, and just plain common sense. There's a decline in mental health among people who had lost their jobs. maybe that was just because maybe that's just coincidental. People who are in poor mental health already lost their jobs, but really we at CHI don't think that. We see a strong link between job loss and declining mental health. And we think this is an important finding that really needs to receive more attention as we plan our, or as we continue our recovery and struggling through the next phase of this pandemic. Okay, back to our data. We see a similar decline in physical health. In fact, twice as many people who lost their job because of the pandemic say their physical health declined as a result of COVID, as a result of the pandemic. Not necessarily people who contracted COVID-19 themselves, but just people who said that their physical health in some way declined. Now, people's health didn't suddenly deteriorate just because they lost their jobs, at least for the most part, and because they lost access to insurance. Medicaid was there to cover people who lost their jobs. And we see on this graph, the uninsured rate did not increase. The 6.5 to 6.6, that's not statistically significant. What happened was that we saw a decline in job-based insurance, as we would expect when so many people were laid off, but then a big expansion in the Medicaid rolls, which almost as if we designed the system that way to be a well-functioning insurance safety net. And as a result, most people who lost their jobs were able to have insurance coverage. So what this graph tells me is that, well, access to health insurance and access to healthcare is really, really critical. It is not what makes people healthy. It is, it's not the only thing that makes people healthy. Again, one of our takeaways is everything's all wrapped up: your economic health, your mental health, your physical health. So here we see, probably no surprise to anybody, that if you lost your job during the pandemic, it was much, much harder to afford the basic everyday necessities. In fact, almost 6 times as difficult for people to afford necessities when they lost their job. Why include such kind of a no-brainer conclusion? Well, first of all, it really emphasizes that economic troubles are a major contributor to stress and worsening mental and physical health. And then also, we saw this result despite these massive federal aid packages that were passed by Congress during both the Trump and Biden administrations. Included extended unemployment benefits, stimulus checks to everybody, several rounds of those. And we still see the difficulty of affording necessities despite all of those interventions. Now we get into the really interesting and I think distressing data. The health consequences of job loss appeared to persist more than a year into the pandemic. So we're shifting from the COVID questions now to the general mental health questions that we've always asked. So we ask, when you take the survey, what's your mental health been like in the past month? And we saw that people who reported losing a job during COVID and were more likely to say, again, in February to June of 2021, that they were in worse mental health than the group that didn't lose a job. And even more troubling, we see there's essentially no difference in people who had lost a job and gotten a new one compared to those who'd lost a job and were still unemployed. Look at the top 2 bars. Statistically, they are identical. That means the mental health consequences of that job loss persisted even after people became employed again. And the physical health effects of job loss also persisted. We asked people to rate their physical health or their own general health at the same time, at the time of the survey. We gave them 5 choices: excellent, very good, good, fair, or poor. And a quarter of people who had lost their jobs during the pandemic, an event that probably happened a year prior to them taking the survey, rated their health as fair or poor. When we parsed this out by people who had regained a job, we did see some spread, but there were spread against people who who were still unemployed. But both groups reported worse general health than Coloradans who didn't lose a job. So when we're talking about people who lost a job, who are they? We'll take a closer look in these next 3 slides about that. Who exactly are we talking about who lost a job? And unfortunately, the answers aren't surprising to anybody familiar with this country's economic history. It's people of color, it's younger adults, it's people with lower incomes. More than a quarter of Native American and Black Coloradans said they lost their job during the pandemic as a result of COVID-19. That compares to just 1 in 10 white Coloradans. This graph shows you really the consequences of the inequities that we've built up in this society over the course of hundreds of years and still haven't found a way to tear down. Then we can look at it by income as well. A fifth of people right around the poverty level said they lost their job during the pandemic, compared to just a tenth of people at 4 times the poverty level, which is right around the median income for Colorado. And then by age, it's people in their late teens and 20s were way more likely to lose their job during the pandemic than workers of other ages. So people of color, it's younger people, and it's people at the lower end of the income scale, folks who already have a lot going against them in succeeding in this economy for various reasons. So the policy implications of this, first of all, like we say, it's all connected. A job provides the means to pay for physical health and stay healthy food, gym memberships, health insurance. Mental health, employment is way more than a job. It's way more than a paycheck. It provides a degree of dignity and self-determination. We know those are really important for mental health. And then also a job is a paycheck. Income provides the means for safe housing and necessities. The basic comforts like a weekend in the mountains or birthday presents for the family. However, our systems to address these realms largely are still separate. The legislature right now has 3 committees going to figure out how to spend about $2 billion in federal stimulus. There's 1 committee on behavioral health, 1 on housing, and 1 on economic development. I think what I'd like to leave you with from this presentation is that behavioral health and social determinants and economic development, they are all of a piece. They are, you really need to address all 3 at once somehow if we want to be improving the health of Coloradans. So with that is our presentation or my part of the presentation for today. I encourage you again, if you found this at all interesting, to get involved in the 2023 Colorado Health Access Survey. Contact my colleague Jeff Bontrager. If one of my colleagues would be so kind as to drop his email address into the chat so you can have it. And then we'll pause there for questions and discussion. I'm going to open up the chat to see if we have anything. If you do have a question, please drop it in the chat, raise your hand, drop it in the Q&A. I'll give it another couple of seconds to let people react. Otherwise, I will turn it over to Lindsay. All right. Well, if you do happen, if a question does occur to you while you're watching Lindsay's presentation, both of us will be sticking with you to the end of the webinar today, and we will have plenty of time to answer questions the way it looks. So I'm gonna turn it over now to Lindsay.
Thanks, Joe. All right, let me get my screen shared. All right. So like we've already kind of seen from Joe's presentation as well, the Colorado Health Access Survey provides us with lots of really rich information, and we're always looking for ways to improve it. So this year we added a military status question, which allows us to understand more about Colorado's military service population in Colorado. So the initial findings provide us a really, I think, a new perspective on military service members in Colorado. And we found some really interesting findings that I will kind of just give high level right now. So Colorado's military service members differ demographically compared to the general population. So for example, they tend to be older than other adult Coloradans in our state. They also use healthcare at higher rates than other adult Coloradans and also have distinct healthcare needs. And Colorado's military service members also were less likely to reach out for behavioral health services than other adults in the state as well. So based on the Colorado Health Access Survey, we found that over 380,000 veterans call Colorado home. And this represents about 9% of the adult population in our state. And about 1 in 5 of them live in El Paso County, which is home to several military bases, which includes Peterson Air Force Base and Fort Carson. So compared to other adult Coloradans in the state, military service members have very unique characteristics. So they are much more likely to be male compared to other adult Coloradans in Colorado, with 85% identifying as male compared to about 45% of other adults based on the CHAS. Military service members also tend to be older than other adult Coloradans, with more than 40% over the age of 65, where we see only about 16% of other adults in Colorado falling into this specific age bracket. They were also more likely to identify as Black or African American and less likely to identify as Hispanic or Latino compared to other adult Coloradans as well. In addition to their unique demographic profile, military service members also have unique healthcare needs. So CHI worked together to put together a needs assessment for Colorado's Veterans Community Living Centers. And we found that Colorado's veterans are more likely to be impacted by specific health outcomes. So these include higher rates of chronic illnesses like heart disease, diabetes, chronic obstructive pulmonary disease or COPD, but also emotional health issues like post-traumatic stress. So these specific healthcare needs in conjunction with service members' unique experiences make it important that our healthcare system meets them with culturally competent care. Now, what is culturally competent care? So it's the ability of healthcare providers and healthcare systems to deliver care that meet the social, cultural, and linguistic needs of patients, which in turn can help improve health outcomes and quality of care. So the CHAS tried to understand some of these characteristics that might impact the kind of healthcare a person needs in Colorado, thus necessitating culturally competent care for these specific individuals. So about 4% of veterans reported that they had a distinct characteristic that impacted the kind of healthcare that they needed. And of those veterans, a large majority of them reported that a disability or physical, mental, or cognitive condition impacted the kind of care that they needed. Military service members have unique experiences like potential exposure to wartime conflict that require culturally competent approaches to their care delivery. And this is especially important as veterans interact with the healthcare system at higher rates than other adult Coloradans in our state. So this graphic displays the percentage of adults in Colorado utilizing healthcare in the past year by military status. We can see here that military service members were more likely to report visiting a general doctor, a specialist, an emergency room, and having a telemedicine visit in the last 12 months compared to other adult Coloradans. And they were also more likely to report that these visits were related to preventative care. So higher rates of engagement with the healthcare system means competent care for these individuals is really important to make sure that they keep engaging so that their specific healthcare needs are met, which in turn can help reduce negative health outcomes. Because military service members engage often with the healthcare system, it is important that they can afford the necessary services to address their unique healthcare needs. So this figure outlines adults who report not getting either needed doctor care or specialist care in the past year due to cost. So affordability here appears to be less of an issue for military service members. We can see that about 9% of military service members reported not getting needed doctor care due to cost in the last 12 months, compared to over 15% of other adult Coloradans. So this is similar trend also seen here in not getting needed specialist care in the last 12 months as well. Affording prescription medicines is also an important component of veterans' health in Colorado. We actually saw that 70% of military service members reported that they currently take a prescription medicine, compared to about 56% of other adult Coloradans. So this figure outlines how adults reported how easy it was to afford their prescription medicines in Colorado. Affording these medications appears to be less of a burden as well. About 7% of military service members reported that it was either somewhat or very difficult to afford their medications, compared to 13% of other adult Coloradans. As military service members are more likely to be older, they are also more likely to be covered by Medicare and are less likely than other Coloradans to be uninsured. This could help them more readily access the services that they need with less worry about being able to afford those specific services. Although military service members were more likely to engage with the healthcare system for their chronic or other specific physical needs, they were no more likely than other adult Coloradans to speak with their providers about their mental health. Additionally, they were less likely to report on several key metrics from the CHAS related to behavioral health. So this figure actually outlines the differences between reported poor mental health, those who reported a future need of behavioral health services in the next year, and those who didn't get needed services in the last year among adults in Colorado by their military status. So we can see here in this figure that veterans were less likely to report 8 or more poor mental health days in the last month compared to other adult Coloradans, with 20% reporting poor mental health compared to 27% of other adults. This was a similar trend for needing future services as well as not getting needed services. These trends can be reflective of the impact of age and gender in this specific group, as we know that they're more likely to be male and to be older. Males and older adults are also seen to be less likely to report on these specific outcomes. However, the distinct characteristics of the military population could also be impacted by stigma on these specific behavioral health issues. So let's take a closer look at these data specifically within the veteran population. Here, this figure has outlined those same specific behavioral health metrics, but by age this time, since we know that age is an important demographic characteristic of the veteran population. So we can see here some key differences in reported mental health outcomes when accounting for age in this population. So those who are under 65 were more likely to report a need for future services, as well as having poor mental health in the last month. Unfortunately, there may also be an unmet need for veterans for certain age groups. Those who are younger were also more likely to report not getting needed mental health services in the last year. However, this could also reflect underreporting for the older veteran generations, as they may feel the impact of stigma more readily than younger generations, as those age 50 to 64 had the highest reported poor mental health rate, but do not seem to engage with behavioral health services to the same degree as younger service members. So COVID-19 impacted many people's lives, which Joe already has really outlined based on job loss in the previous presentation. And this is also seen, veterans were also impacted as well, both at an economic and health level. So according to the CHAS, about 25,000 military service members lost their job due to COVID-19, while another 88,000 had a decline in their mental health due to the pandemic. So this figure identifies other impacts of COVID-19 on the military service population by age in Colorado, which include those who experienced reduced hours or income, those who reported struggling to pay for basic necessities, struggled to pay their rent or mortgage, and had a reported decline in their mental health as a result of the pandemic. So unfortunately, younger veterans were also more likely to feel the burden of these issues. Those under 50 were more likely to report reduced hours or income due to COVID-19, and those under 36 were more likely to report a decline in their mental health due to COVID-19. They also were more likely to struggle to pay for housing and basic necessities. So compounded with the impact of COVID, as well as existing needs for behavioral health services for younger veterans, could have serious implications for veterans and their needs moving forward. And finding ways to identify and combat these needs for this specific population is very important. So we've learned a lot from the new CHAS data, and the new veteran identifier allowed us to understand a lot more about this unique population in Colorado. So I just wanted to reiterate some of these key findings for us. So veterans have a unique demographic profile compared to other adult Coloradans. They also use healthcare more often and have distinct healthcare needs. And they are also less likely than other adults in Colorado to reach out for mental health services. So these new findings on the veterans in Colorado is really just the beginning of the kinds of analyses that CHI can do with the 2021 CHAS data. And these data were just a snapshot of the data available on the veteran population as well. In addition to available data on the veteran population, we have additional data available on telemedicine use and quality of care, impacts of COVID-19 on different groups in Colorado, additional behavioral health data, as well as new disaggregated race and ethnicity data, as well as so much more that was added to the 2021 CHAS. So it's a big part of my job to make sure that these data get out to the people who can use them to inform on their work and make a difference for Coloradans' health. Create policy that can address inequities that currently exist and support programs at the local level to try to combat these. So I also wanted to show some available materials that we have. So please feel free to reach out to me with any additional questions that you may have about these new data, or if you are interested in getting access to any specific data, perhaps for populations of interest that people are looking at. So we also have a lot of other resources available to help support your work available online. So this includes regional and demographic workbooks, regional profiles for different health statistics regions in Colorado. We have the 2021 CHAS Storybook publication that includes a lot of these analyses and stories from people that are doing work on the ground in Colorado. We have a public use data file available online as well that can help you do some of your own analyses. As well as so much more for different materials available on the CHAS, including methodology report and any other technical documentation as well. So we at CHI, we're already thinking about the development of the 2023 Colorado Health Access Survey and what kinds of data would be most helpful to inform on policy and health in Colorado. So like Joe mentioned, if you're interested in sponsoring or either just kind of helping us inform on what kind of questions would be helpful to ask and have any ideas on topics, we welcome you to reach out to us specifically to Jeff Bontrager. His email is included here to learn more about that process. And I will open it up for questions and discussion.
Lindsay, I see one question right now from Juan Roberto Madrid. He says, "There's great information. Thank you, Juan. I'm curious if it's possible to get similar information related to agricultural occupation, like farmers and ranchers."
Let's see. So specifically on the CHAS, we don't have any job-related identifiers right now, but there is a lot of data available on the American Community Survey that has occupational data outlined for all sorts of different industries. So if you have, I can actually look through that, but if you want to email me, I can kind of put something together and look into that for you as well. That's a good source, I would say, for occupational specific data.
And in a more kind of blunt way, we could do we could look at rural counties based
Right.
on the or rural regions based on their economy. I would
Mhm.
say a bit more agricultural economy as well. We
Yeah.
could do that through the jazz. All right, let's, if you wouldn't mind taking your share off so we
Yeah.
can both pop back on here. And all right, a couple other questions, comments earlier on that some of my colleagues have already addressed in the chat. You know, Bethany Prey says it'd be interesting to see health-related effects of unemployment in future years,
Mhm.
and that this is exactly the type of input that we're looking for. If this feels interesting to you, then advocate for it in the 2023 Chaz, and use it if you can in your work going forward. And please accept Lindsay's invitation to ask her for similar cuts of the data. That
Mhm.
this is the survey is, we find it really an amazing resource, but it's only useful to the extent that people in the community use it. We want it to be a community asset. Our sponsors want it to be a community asset. That's why they fund it. So we hope this is an example of the type of things that we could do. If an idea pops into your head, don't think that we haven't that we've already thought of it. We might not have. There are thousands of ways to cut this data, and we're only just starting out. So if you have an idea, please get in touch with us.
So Karen and
Mhm.
Bethany both have good questions, and Lindsay, I'm looking specifically at Karen's question and
Mhm.
wondering if not through the Chaz, maybe if our other veterans report might address that.
Yes, so that's a great question. So Karen asked, any information on the migration of veterans from the Western Slope towards Denver or out of state? So a good source for kind of movement around the state is also the American Community Survey. There is a question about if they moved between, I think it's between counties, between states. It has a lot of different facets to that. And the American Community Survey also has a military status identifier. So that's an analysis that we can also do as well with that data source. But that would be really interesting to see as well.
And then another question from Bethany: do we know what percentage of veterans are Medicaid enrolled? I don't know if you ran that.
I have it pulled up. Yes,
right.
I saw that question. So based on the data that I've run so far, we can see that about 15% of military service members are covered by Medicaid, and we can see about 34% are Medicare covered. Compared to the non-military population, the Medicaid is pretty similar at 13%, but Medicare is much lower at 22%. But this, I think coverage in the veteran population is a really interesting component, because not only do they have access to Medicare coverage, they also have more specific coverage availability through the VA and other sources that the general population doesn't have. So one analysis I really want to look into is like dual coverage or multi-coverage for this population, because we do see a much lower uninsured rate. And I would be curious to see how many have multiple coverage types, and then what that kind of looks like and what percentages that is. I think that would be really cool to look at.
All right. Anything else? Well, we are 7 days past Veterans Day on this, but we'd be remiss to say if there are any veterans in our audience today, or family members of veterans, thank you for serving your country and us. And we see in this data the sacrifice that entails. Well, with that, I'll make one more invitation. Get involved, use this data. Oh, sorry, question just popped in from Juan. Wondering about veterans who may not have reached retirement eligibility and thus not qualify, and maybe also not qualify for military insurance coverage. 'Cause we do know from some of our other work, there is a large portion of veterans who are eligible but are not enrolled and taking advantage of their benefits.
Yeah, and that process for eligibility is really complicated and
Yeah.
sometimes hard to traverse as for the veteran population.
Yeah, that's some, yeah. And thanks, Christy, for dropping that link to that report in there. It's something we did apart from the Colorado Health Access Survey, but also, the survey data can help inform that as well. So, well, we will let you refill your coffee. I know I want to refill mine every morning when we do these. So thanks so much for joining us this morning, for supporting CHI and the Colorado Health Access Survey. Look for a lot more of this. We have a couple of years to analyze these numbers. And if you have an idea, let us know. It's probably a good idea. So get in touch with us. Talk to Lindsay, talk to me, talk to Jeff, and we will we're here for you. Thanks a lot. And I'll stop recording and let you go on with your day. Go out there and do your good work. Thank you.